Jim Joyce, we're
Hey,
back.
hey.
We're back. I think we missed a week or two in there, but and I love your office.
Yeah, thank you. Thank you. This is
Very, very nicely done.
there's some patents there in the background. You see that
I
on the
love it.
wall?
I love it. I love it. I actually thought it was where's your name on those patents?
Yeah, they're probably small print. Small print.
Anyway, well, I've been looking forward to meeting our next guest. As you know, we don't have many guests that either one of us have not met. I think we maybe had one or two.
Right.
So we're letting Mark Gaunya in, and he will correct us on the pronunciation of the last name because
Amazing.
we haven't met. Welcome, Mark.
Hello there.
Welcome, welcome. We were just kind of Jim and I were saying that typically on this show we have people that either I met or Jim met.
Yes.
And we only had one or two before that we haven't met. So the introduction came from Megan
Megan
from
Donnell.
your
That's
team.
correct.
Yes.
That's correct.
She was super excited. And I think your background was just pretty impressive. And we kind of decided to learn more about you because that's what the show is all about, is to get people like yourself on and talk about usually over a drink, but water is fine.
I
So
got that right
welcome
here.
to the shot.
Okay. Thank you. I appreciate it. My name's pronounced Gaunya, so it's Mark Gaunya.
Ganya. Okay, see, I
Nice.
did screw it up. I knew it.
Nice
It's
to
okay. A lot of
But now
people
we
do
know.
a lot of vowels for six letters. You know what I mean? A
nice
lot
to
of
meet you,
Well,
Mark. Nice to meet
try
you.
mine. I don't think there's anybody who's pronounced it correctly ever, aside from my parents. But anyway, well,
Burayukovich.
Well,
Borohovich. But but
Burakovich.
but that was close. That was close.
That's pretty close.
You're in the top
Well, I have a
top
complicated name, so
1%.
I try to figure out other complicated names.
exactly. Very good.
Love it. Well, welcome to the shot.
Thank
We've
you.
been looking forward to it. I know we scheduled it a bit back, and for our
Great.
millions of listeners and viewers, we want to get to know you. So take us through your journey, personal, professional, however you want to take it, and then
Go way
Jim and
back.
I, yeah, let's
Okay.
go
All right.
way back.
I'll go all the way back to the beginning and blame it on my parents.
There you
Exactly.
go.
Exactly.
There
Where are
you
you
I
go.
calling
literally,
from?
I literally am going to blame it on them because both of them introduced me to healthcare as a young
Awesome.
kid. My mom and dad were clinicians. My mom was a cardiac rehabilitation nurse, and my dad was a orthopedic sports medicine physical therapist. But they were gifted clinicians, but they were entrepreneurial in the way they went about business. They didn't like the corporate practice of medicine.
Okay.
So they created an outpatient physical therapy management company. And when I got out of college, I went to work for them.
Where was this, Mark?
This was, well, they were headquartered in Alexandria, Virginia. So we
Okay.
had three facilities in Virginia, one in New York, and two in Massachusetts. Because my dad had a lot of relationships up and down the East Coast, and his model was a pretty simple one. He'd go find a community hospital that he could be a co-general partner with, and then he'd find 10 orthopedic surgeons, actually nine, plus one radiologist. I would
Okay.
tell you the radiologists are really the ones who kind of navigate everybody through healthcare, right? And then by virtue of that group of individuals in a hospital, he would create enough capital to be able to create a multi-million-dollar physical therapy operation that the physicians could know they could send their patients to, and they would get exceptional quality care.
Yeah.
So
Right.
that's why I say I blame it on my mom and dad,
Exactly.
because I grew
And
up.
so
And
we
Go ahead,
so
Jim. Go ahead.
we so you grew up in Alexander or Boston or
So I was born in Pittsburgh, Pennsylvania.
okay.
That's where my love of the Pittsburgh Steelers comes from. So
um,
diehard
and a
Steelers.
beautiful city. Just what a
It's a
beautiful
beautiful
city.
city, beautiful city. My dad went to Pitt grad school, and he was the trainer for the Pitt Panthers football team.
Okay.
And I was born when he was in school. I lived there till I was 6 or 7 years old. Then we moved back to New England, where my dad was from. My mom and dad are both from New England. Mom was from
Yeah.
New Hampshire. Dad was from Connecticut.
Okay.
We lived there until my teenage years, and then my father had a unique opportunity to move us down to Northern Virginia,
Okay.
in Alexandria, and so I went to high school down there, and that's when he created this company.
Did you go to like Gonzaga or something? What was the
No, I
school?
went I went to University of Rhode Island. That's where I went to school.
Oh,
I
okay.
came
Okay.
I
But in
came back.
Virginia.
I came back. So I was down in Virginia. Oh, you mean
Yeah.
high school? I was at a high school called Fort Hunt, which is
Okay.
just now, it's no longer open. It's now called West Potomac.
Okay.
If you've ever been to Old Town Alexandria, I live 3 miles from Old Town Alexandria.
But it's very much you're in like the DC belt, right? Right? Is that
Correct.
the right? So are
Yeah.
you a political wonk? Not that we want to get
No, actually, to be honest, Jim, I don't like politics.
okay,
I
good,
love
good.
policy. In fact, I try to lift the conversation out of politics and
Yep.
into policy.
Policy.
Okay.
Yep. Yep.
I remember what Condoleezza Rice said one day when I saw her at a conference speaking, and she was asked after she left the Bush administration, "Will you ever run for president?" Because, by all accounts, she's brilliant, she's a wonderful person, and she said
Right.
no, like straight out, no. And they're like,
Yeah, yeah.
"Why?" And she said, "Because I hate politics, but I love policy. So I'm always happy to
True.
support any administration if they want the support, but I don't want to be a politician, and I'm not a politician."
Got it, got it. Okay, so
Just
but
want to get shit done.
Yeah.
if someone it's so not to pry here, but someone saw like Mark on the playground in Alexander or the high school, maybe not playground, high school, what would they have thought? What were you into? What were you doing?
So I was a wrestler. I was a football player, and I was
Okay,
a baseball player. But my biggest love was wrestling.
okay,
I love to wrestle. I enjoyed the enormous resilience it takes to be a wrestler. I mean, you're
sure,
talking about strength and agility and nutrition and flexibility and speed, and you have no one to point to but yourself when the
right.
match is over.
And
And I
you flex your weight down, and right before the
I
match, we
would
do
play football at 170, and I'd wrestle at 145.
Oh
145.
wow. Oh
I'm
Back
wow.
in the day
170.
when they didn't check your, how hydrated you were or how malnourished you were. Remember, this was in the 80s, okay? It was
Yeah,
very
yeah,
different than it is today. Very,
yeah.
very
Well,
different.
Eugene, this is something I know. I was a varsity wrestler.
Oh, how
Yeah,
about
Dude,
that,
this is
Jim?
the first time I hear this. I learned
yeah.
so much.
We've been doing a.
Thank
We
you,
were just.
Mark. Thank you for bringing this up because I just
What
learned a
weight
new
did you
fact.
wrestle,
And
Jim?
Oh, I wasn't. I don't think I could just. I can't tell by Zoom, but I don't think I was your size. So I was. I would suck down. I would wrestle. I'd go from 140 down to like 130 or something. Like that was kind of the. And then sometimes I would get down with they didn't check the hydration even lower, right?
Yes. Yeah. It was a really, I used to wear plastic suits and jump rope in the sauna and lose
Did
10.
all that.
The most I ever lost in one setting was 10 pounds in one day to make weight.
what?
It's not
That's
good
a
for you. But I
Yeah,
did. That's what I did.
yeah, yeah.
that's
But it was the whole
wow.
thing, right? It was a whole thing. You're right, like you said. Okay, so you were a wrestler, a football
But
player.
Well,
sorry, I just want to
wrestle.
pause because
Yeah.
all the things that you described, what you need to be a wrestler is what you need to be a human, right? Really, right? Like resilience,
Yeah,
preparedness, nutrition, right? Like it's
yeah,
just like it should be almost taught every day across those pillars,
right.
right? And I
And that's
think
why I loved wrestling because of all the discipline it brought to life, the sacrifices you have to make, as other people are sitting there and enjoying a pizza and you can't do that because you have to make weight. Just
Right.
just the whole notion of it. But the one thing I didn't like about wrestling was the cutting weight part. I just really
Yeah.
did not like that. I love food, and I don't like to deprive myself. I mean, I like to eat things in moderation, right? But I don't like to deprive myself. So I
Yeah.
tell you that because when I went to college, I walked on to the University of Rhode Island wrestling program, but
Okay.
they pushed all the money out of wrestling and put it into football, and
Right.
everybody was there on scholarship. I wasn't one.
Yeah.
Transferred away, and there were 15 of us, 19-year-olds saying, "Okay, what are we going to do now? Like,
Right.
okay, we're going to start a club sport. We're going to do something different." And this is still the best single sales pitch I've ever heard in my entire life. And remember,
Let
I
me hear it.
sell for a
Yeah.
living, pretty much. I do a lot of things, but selling and influencing people's thinking is something I love to do. The rugby coach came in to speak to us, and he said, "How would you like to play a sport that's as violent as wrestling? But you don't have to cut weight, and you can drink all the beer you want." And I'm like, the 15, 19-year-olds are all looking at each other like, "What do you
Yeah.
think?" I'm like, "All right,
What
we'll
is
give it a shot."
Well,
So,
I'm calling from I'm in Dublin here. There's a place for you in Dublin for sure.
oh, no doubt about it. So I played rugby for 12 years. I played
Yeah.
4 years in college and 8 years in men's league after I graduated college. And I
Okay.
remember the first practice I ever went to. I had no idea what I was doing. I really had no idea. They're just like, whoever has the ball, hit him. I'm like, okay, I can do that. So for 2 hours, I ran around hitting guys on my own team, hitting guys on the other team. I was a little bloody, definitely muddy. And then 60 guys, aged 19 to 23, they break out a pony keg and they tap the pony keg, and the captain fills a cup of beer up and he walks up to me. He's like, He's like, welcome to the club. I'm like, oh, this is great, man. Are you kidding me? After being completely exhausted, right? Not having to cut weight, I'm like, I get a beer, and then they start singing songs, and I'm like, these songs are offensive to girls, but I'm 19. This is fantastic. Like legal violence, I get to drink a beer and I get to talk smack about girls. I am never leaving this sport.
Right. Awesome.
Amazing.
And then we won the New England's my junior year, and then I went on to play men's league after that. So that's my rugby story.
That's awesome.
So Rhode Island.
I was gonna say Rhode Island school. Let's keep and what did you study in school?
I studied finance in school. I first went in for accounting, which is kind of odd, right? Because I quickly realized that accounting was focusing on the past, and I don't really do well with that. I'm somebody who's geared to look to the future. In fact, my unique ability is vision, right? My business partner says I look around corners, right? I see things that people don't see long before they become something that people adopt, which will fit into my story professionally, and I'll share that with you. But so I studied finance. I moved from accounting to finance because I'm like, well, I don't really like recording history, but I like taking $1 and making it into $5. How can we do that?
Mm-hmm.
That was my logic.
And let the accountants worry about the margins.
They can do all the scorekeeping they want to.
Backward, yeah.
They can do. I'm imagining things aren't even there yet, creating dollars that they're accounting for, right? So, but when I left college, I went to go work first I went out and got a job myself in commercial real estate because I thought that's what I wanted to do. But when I got out of school in 1989, the real estate market crashed. 89, 90, it was bad. And so my dad said, all right, you proved you can work on your own and get a job by yourself. Do you want to come work with me now? I'm like, sure. Doing what? He's like, well, I need help in the accounting and finance function. I'm like, okay. So I ended up being their payroll manager, their accounts payable manager, their accounts receivable manager. Then I moved up to assistant controller. Then I moved up to controller, doing books every single month, every single quarter, every single year. Right. Why did I want to do that? I knew someday I would be an entrepreneur because it's in my blood. And I also knew that in order for people not to steal from me, I had to learn how to construct a financial statement and be able to read a financial statement. And now as a business owner of multiple businesses, I can do that. I can quickly look at a P&L, a balance sheet, or a cash flow statement and know exactly where to look to tell me exactly what I need to know about the health of the business that I'm looking at. So while I didn't like that 5 years, it was the foundation for me to learn how business works, from an.
I love what do you think, Eugene? I love the whole, the finance of entrepreneurship. I find fascinating. I similarly, kind of went through accountancy,
Yeah, it's funny. I initially in college, I majored in finance, and then I actually switched to tech, right? Just because same thing, like I was bored, I wanted to create stuff.
Exactly.
But I think to your point, Jim, I don't like the minutia of doing the books, but to me it's the fascination of the revenue, the margin optimization, the unit economics, what's
it's a story.
It's the story, right? I mean, the way I look at this always is, people say, well, data speaks for itself. Actually, no, data never speaks. It's the humans that describe that data. And that's why
it kind of mumbles. It mumbles until someone.
It's like you can hear some whispers, but like, what the hell is it, right? You just got to relay it on the other side.
The practice of medicine. We look at all these different things, right? And then we try and that's why they call it practicing medicine, right? Because you're looking at different things to rule out things to ultimately find the source, the root cause of whatever it is you're dealing with. I mean, that's what it's all about. Same with business. Financial statements tell you the health of the business so that you can focus on the right things.
Exactly. So what a great background. So you kind of worked your way up, seeing the bones of the operation and obviously working with your father. So then what happened then?
Yeah, so then a law was passed. Politicians in California passed a law that prohibited physicians from referring patients to facilities they had an ownership interest in.
Okay.
Which on the surface of things sounds like it makes sense, but when you're providing exceptional quality care, it doesn't make any sense that you'd restrict people from sending their patient to a place they know their outcomes are extraordinary. Because my dad's whole mission was, you were a tennis player, you broke your ankle, I'm going to get you back on the tennis court, I'm going to get you back fast, you're going to be better than you were before you got hurt. If you're a guy who plays golf and you got a bad back, I'm going to get your back better so that you're even a
Hmm.
golfer after I'm done working with you because we've made your body better than it was when you came to see me. And my
I like
mom
it.
was like that with cardiac rehab. She was, you had a heart attack. I'm going to help you restore not only your belief that you're going to continue to live, but I'm going to teach you how to live in a better way so that you don't have to have another heart attack. You don't have to
Right.
have another
Take the
emergency.
tragedy and turn it into something like an ambitious opportunity. I love
That's
it.
correct. So when
Yeah.
that law passed, my parents had to wind down their company, and that was a very painful experience for me. We had
Okay.
to shut two of the facilities down. We sold four of them, and I essentially helped my parents retire from the business. And
Okay.
I lost the path I was on, which was I'm going to be the guy who's going to be running this thing.
Running it. Yeah.
Right?
Hmm.
That was my thought.
Yeah.
And my thought was, okay, if I have a finance and or sales and marketing background, that's about 85% of what CEOs have. Very few are operationally oriented. They have a COO, but usually CEOs don't come out of the operations area. They come out of finance or sales and marketing. So
Sure.
I left there and I went to go work for insurance carriers. I went to go work for Blue Cross Blue Shield of Washington, D.C.
Yep.
Amazingly enough, in the accounting function. I'll tell you a funny story about that too. And then I went to go work for Cigna in Chicago. And then
Sure.
I left Cigna in Chicago and I worked for a startup consumer-driven health insurance company called Destiny Health, which is a U.S.
Yeah.
expansion out of South Africa from a company called Discovery Health. And so we
Okay.
were the ones who were selling what are now called HSAs before they were called HSAs. It was
Okay.
Interesting.
pioneering. It was a big pioneering event.
Yep.
Um, so back in the Blue Cross day, when I went to go work for Blue Cross, the only place I really had a track record was accounting and finance. So the CFO hired me. And then I remember one all company meeting, he said, to like 1,700 associates, if anybody's looking for extra project work, come see me after the meeting. And I was the only one who went up to him
Right.
after the meeting.
That's crazy to me.
I would like to,
I believe you, by the way, but
I would like to volunteer because, a rugby player, wrestler, why not? I'd like to volunteer for a project. Can you get me involved? He's like, yeah, we have this project where we need to get this couple things done in this integration work, and it's not going well, and there's a lot of money riding on this. He goes, but it's not really. He goes, it's more of a project management role. I'm like, sounds great to me. And so, but long story short, I helped get the integration work done. I helped the deal happen. And then the chief sales officer said, you know what? I know you don't know anything about selling anything, but I like who you are as a human being. And somebody saw something in me at a young age. I see it in you, and I'm going to give you a shot. And he put me into a director of client service role. I was like managing 21 people who were, 80% of them were old enough to be my parents. 80% of that were African American, so it was a different mix of people. It
Okay.
was downtown DC, but we set records. I mean, my job was to retain accounts, and we went from 80% retention to 96% retention in my first year. And
When
that,
you have to all
yeah,
of
I
a
was
sudden
gonna
that
say,
young age and you got to manage 21 people, what
what was
went
going
well?
through your head?
What went pear-shaped? What went well? Because I'm sure it was probably
I
something.
wasn't scared. I was excited about the opportunity, but I did not want to fail.
Right.
Right? Because there's no part of, I'm a competitive athlete, you guys. So at the very core of who I am, I like to compete and I like to win. And so my thought process going in was I have an opportunity to really set my career off in a much more exciting space than accounting. And I get a chance to be on the front line, on the top line, because my dad always told me when you're on the top line, you always have protection. When you're on the bottom line, when you're on the expense side, anybody can walk into your office at any point in time and tell you,
Yep.
Mark, sorry, we're cutting expenses. We got to say goodbye. I'm like, you know what?
Yep.
That makes sense. As a finance guy, right? I want to be on the revenue
Yeah,
side,
if you're
not on the
bringing the
expense side.
bacon, yeah.
So my first thought was I got to get to know all these people and I got to know them as people and say to them, look, I know I'm young. I know that you probably look at me like, how the hell is this guy my manager? And I get that. I'd be saying the same things. But my job is to help you have a better time at work and make more money. And that's what I'm going to help you do.
Right.
It started with their compensation plan. I'm like, okay, your comp plan stinks. And they're like, you're telling us. I'm like, it's awful. So I'm going to reconstruct a compensation plan that's going to require you guys to do some things you haven't done, but I'm telling you, you're going to make a lot more money if you work with me on it.
Hmm.
Right.
I went from being the man in the pejorative word to being the man with a bottle of champagne. When by the end of the first year, they're all making $10,000,
Right.
$20,000 more than they made the year before, and we set company records. right?
Right. So, but like as you were saying this, I was thinking, and Eugene, you probably had this. All of a sudden, you're relatively young, and you get promoted a little, like
I
maybe
was
over your ski.
26.
Yeah, you get promoted
Oh, I
over
thought
your
you're calling
ski.
me relatively young now.
No, I'm
So,
talking. No, I'm talking in the Wayback Machine.
oh
You're
shit.
sitting
Wayback Machine.
in the Wayback Machine, and you're like, and all of a sudden you get thrown this like big like people challenge. And so, I think we create, and you're obviously good at doing that, Mark. Create the story of like, okay, here's all the great things I did, right? But I was thinking about when I was put into that shoes, and I kind of walked in kind of similar with all this energy, all this ideas. Some of it went really well, and some of it was like a little too much. It was like, my intensity kind of threw it in there. But you
Yes.
didn't have that. Everything just went well.
No. Of course. I mean, look, every story is filled with cloudy days and rainy days, and I tell my team now it won't rain forever. So just know the rain comes, the rain disappears,
Yep.
and the sunshine comes out. And if you've been around long enough, you know that's how life works. Not only being a human being, but being in any profession. So
For sure.
no, there were mistakes I made along the way. I was very hard charging. In fact, I know one of the questions you guys wanted to ask me was what would I tell a younger version of myself?
Yeah,
To be
later. We'll do that
patient.
later. We'll
Yeah,
do that.
no. But so
We'll do that
I'm
later.
applying it to this story is to allow people to come along with you, but really take time to understand them and what they need out of life, and then you'll achieve your goals if you're
Sure.
conscious about the goals and objectives they have. So I had some mistakes along the way. I was very focused, very disciplined. I think this is probably from my wrestling days. We're
Sure.
going to do things a certain kind of way.
Right.
Like there's only one way to do a push-up correctly. There's only one way to do a pull-up correctly. There's only one way to do a wrestling move correctly. And so we're going to get the
Right.
basics down. And some people were not disciplined like that. So I had to learn different styles of different people and how I could coach different styles. And some of them
Right.
frustrated me. I'll just be honest with you.
Right.
It was challenging. Some of them didn't make the trip. I had to learn how to fire people and hire
Right.
people.
Yep.
And when you're half their age, that's not an easy thing to do.
It's hard.
It
So
was
it's hard.
really hard.
Yeah.
And then being a member of the executive leadership team, just learning how to sit at a board table. Fortunately, my parents' experience in their company, they would throw me into situations where I didn't belong, and then they'd let me swim. And if I looked like I was going under, they'd throw me a life raft.
Right.
Right.
Yep.
So because of that experience, it equipped me for the boardroom in corporate America. The challenge with corporate America and me is I'm not a corporate guy.
Okay.
So I did that stuff for about 10 years. And
Hey,
fought.
you lasted a decade, so
Yeah, I
kudos to
lasted a
you.
decade,
Yeah.
but I'd last like 2 or 3 years in every one location. So when Jim says everything went great, no, I would exhaust my welcome because I'm hard charging, I'm entrepreneurial, I'm innovative, and big companies don't like to change, and they don't like to change at the frequency I like to change, which is constant evolution.
Yeah.
So I learned that about myself. Like I could never be in anywhere longer than 3 years, or I would just wear out my welcome.
So we got some parallels. I still remember when I came into big pharma, apparently there were big bets on how long Eugene will last. Like they were literally bets, but anyway,
Yeah, so
um,
I was telling you guys about my startup with Destiny Health, and I'll bring that up real quick just to say that Destiny ended up entering into a relationship with Tufts Health Plan in New England. And I was
Okay.
asked because I'm from New England, would you go head up the partnership? And so it was a chance for me to move closer to my mom and dad. They lived on Cape Cod. And I'm like, I'm going to do this because I don't know how long they're going to be alive. And I'm glad I did it because my mom died very
yeah.
young. She died at 69, 13
Oh
years ago.
wow. So
And I was 43. It was really, really hard. But I'm glad I did that because I could be closer to them. And then by virtue of being here, I met my now business partner, Jennifer Borislow. She had her own agency. She started it from scratch in 1982. She was an all-female shop. She had a very good reputation in the marketplace, and she and I became the best of friends. I would call her one of my best friends for the first 3 years I was in this market, and she kept chipping away at me saying, why are you wasting your talent over there? Why don't you come work with me?
right.
I don't want to be an employee at a 13-person company. I'm already a senior officer at a health insurance plan with 2,000 employees. And I at that time, I thought I wanted to be a health insurance CEO. I didn't, but I thought I did.
Right.
And
Right.
finally, she changed it and said, well, how about coming in and being my partner? I'm like, well, that's different. That conversation is vastly different than the one we've been having.
Then
So
yeah.
Yeah.
let's have that conversation. So we did. I read a book called The Partnership Charter by I think his name's Jonathan. I know his last name's Gage, Gage. So I read a book on partnership charter, and I followed the best practices in that book to actually help us create what I fondly call now our bylaws with each other, right?
Okay.
Who we are as humans, what our values are, what our principles are. I know you're the majority. I'm not even a shareholder yet, but I will be, and I know you're always going to be the majority. But I don't want to feel like you're the majority. Otherwise, how are we going to be business partners? And so that's how we constructed how we're going to work together. And we spent 3 months hammering that out before I joined her, so that we were crystal clear about how we were going to operate before we got in business together.
Rules of engagement.
That's right. And we became 1 + 1 = 3. We went from 13 employees, and I used to walk around saying 13 women and 1 lucky guy because I was the only man.
That's amazing. Yeah.
And most days I meant it. Some days I didn't mean it. Most days I did, but always with Jennifer is somebody I love, like my family member. So I always say the love is always there. It's the like that comes and goes.
Yeah.
Like clouds show up, and then
Listen, we all need to take sometimes deep breaths. There's certain battles that you pick, certain battles you just don't go into because, ultimately maybe some of those decisions are reversible at the end of the day, right? So,
correct. And winning is not always winning. Winning can be losing.
Exactly. Exactly.
If you're not willing to, like any good relationship, there's got to be give and take between the partners. And I would always go back to I love her, and I know she loves me like a family member. And so, we're gonna figure things out, and we have. I've been with her now 20 years, and we now have close to 90 employees on our team, and we're operating nationally instead of just in our local backyard here in Boston.
And question for you. I mean, would love to dig deeper, but I see behind you is Captivated Health, and you also mentioned health consumerism, and I know you're involved in policy, so maybe we can kind of chat a little bit about that because you started with policy, right? And your love for
now you
it.
kind of understand a little bit about the guy.
Exactly.
So, Captivated Health is the outward manifestation of my belief that we can create a better healthcare experience for people. Our target market is the middle market. So we work with companies that have 50 to 500 employees. Okay. Nationally, in that market, there are 50 million people who get their health insurance from their employer. It's about $500 billion of spend in that marketplace. Okay, so it's a big market, and that market segment for employers is overcharged for the risk that they present insurance companies. And so through Borislow Insurance, which is the name of our insurance agency, it's my business partner's name. Captivated Health was created out of my desire to help us differentiate ourselves in the market, but even more so for me to feed my why. So what's my why? I've spent years thinking about this, and I can say it in one sentence. I want to make healthcare easier and more affordable for people. That's what I care about. And people are like, well, you sell insurance, Mark. I'm like, well, I get paid by placing insurance, but I don't really care about insurance. So like, what? You're a co-owner of a multi-million-dollar insurance agency. What do you mean you don't care about insurance? I'm like, I don't. I care about the ability to help people get high quality healthcare at the lowest possible price and be helped through their healthcare event, because it's the most precious thing we have, and the system's not set up for you and me. Oh, Mark, healthcare is broken. I'm like, no, it's not. What do you mean it's not? I'm like, it works exactly the way it was designed by the people who designed it. Well, what do you mean? I'm like, well, if
you put that lens on it, you're right.
It's true. And we all work in it, right? So, I always say I'm not being pejorative to people I know in each of these areas, right? Because I know wonderful people in all these areas I'm about to mention. But I believe the system has been constructed for the system, not for the people. And so what do I mean? The Medicare and Medicaid are government run, right? That's the indigent population and 65 plus. That's about half the country.
Yep.
The other half gets their insurance through private insurance, right? About 170 million people. And I already shared with you 50 million get it through the middle market. The other 4 rule-making entities in our healthcare system are big health insurance companies, right? BUCAS, Blue Cross, United, Cigna. Big hospital systems, and there's one in every metropolitan area that controls about 60% of the supply of healthcare. And then PBMs, who control the access to drugs. The 4 of them got together and created this thing we call our healthcare system. And they administer their construct through an opaque process called coding and billing. People are like, what, Mark? I'm like, yeah. You know, the price of things that you don't find out until after you had a visit, the quality of care, you have no idea what the quality is before you actually even get the service. Yeah, that's what I'm talking about. So my desire.
It must have been helpful to be an accounting geek to understand all the
Right.
billing and coding, right?
Well, that also, and being on the, people always say, Mark, you're a broker. I'm like, yeah, so you have a broker box in your head, put me in there. But I'm in the farthest, tiniest, remotest corner of that box you can find. I grew up on the provider side. I worked for the payer side, and now I've been on the consulting and consumer side for the last 20 years. So I do not look at the healthcare system like my colleagues, most of them, because they haven't been on all three sides of the equation, and I have. And I like to tell people the truth of how it's set up, not because I want to attack the people, but because I don't believe the design gets me to my why, which is how do we help people get the highest quality care at the lowest possible price and be helped through their event, and make sure that they're maximizing the enormous investment. Companies spend billions of dollars, literally, providing health insurance to their employees, and their employees don't like the experience. It goes up every year. Their employer has to water down their benefits. They got to take more money out of their paychecks. They got to change ID cards from Blue Cross to United to Cigna to Aetna. I call it the less bad hamster wheel, by the way. That's what it's called.
Right.
Less bad renewal hamster wheel. So Captivated Health is a platform that we created that allows group purchasing to exist for middle market companies who are unrelated to one another.
Okay.
And it allows them to exit the world governed by the Affordable Care Act and move to the world governed by ERISA. And when you, it doesn't mean you don't have to comply with Affordable Care Act regulations. You do, but in large part you're governed by ERISA, which is federally preempts state law. Why is that important? Because when you cross over to be into ERISA, you now are the plan sponsor the employer is, and you have access. You first of all, you have all the control. Secondarily, you have access to all your data. And when you have data, what can you do? You can actually look at, not by person, but what is going on with my people?
Yeah, at the population level.
Right. So we have clients where we're able to, through the data, tell them, well, you have a mental health challenge here. And if we don't do something about it, we're going to see some extraordinary large mental health claims. You have an MSK population that people are getting hips and knees and back surgeries left and right, and they're going to substandard quality care providers. And they're paying 5 times, 6 times more than they should. For that particular surgery, because they're going to a brand name hospital that's not really good at it. Yeah, they're a brand name hospital, but they're not good at MSK stuff, right? Or we have a client that has a maternity risk problem, like we have an all-girls school that they had a high maternity risk, and so we're able to identify that for them and then negotiate a contract with Vanderbilt Health System that cut their maternity claims in half and gave the moms a better experience. Like that's the stuff where you're really impacting the employee. And how does that happen? When an employer crosses over into the self-funded world, they actually take their health insurance expense off their P&L and they bring it to the balance. And people are like, Mark, what do you mean? I'm like, well, you're going to create a healthcare account, a reserve account, and your money and your employees' money is going to go in that account on the asset side of your balance sheet. On the liability side, we're going to have this thing called IBNR, incurred but not reported. That's all the claims that your people, for all the services they're getting. And when the cash is greater than the liability, that's called surplus. Today, it's called insurance carrier profit, which, by the way, you're giving to the insurance company. How about you keep that on your balance sheet? Oh, wow. Like CFOs love that. They're like, what? I'm like, move your mind to the balance sheet. Get off the P&L.
So let me ask you a question. Let me double click on it, right? I mean, you have, fully insured, self-insured, kind of the major buckets. And, typically, obviously, it takes a lot more work to be self-insured, just from a company's perspective. And so Captivated Health, even if you have, 200 employees, you can be part of Captivated Health. And under that umbrella, take advantage of being self-insured. Okay, just
you're not doing it on your own. So the danger for middle market companies, right? Companies like 200, like you just talked about, is the volatility of large claims.
Yeah.
And all it takes is 2 or 3 really large claims, and then it becomes an unattractive proposition for them.
Right.
So the captive structure allows a mid-market company to do is to self-insure their risk, and they buy stop loss coverage, right? For any one person, they're protected at a certain limit of liability, and they have an umbrella over their entire liability. So they always know what their worst case scenario is going in.
So there's not risk pooling.
No. So then the next part of this, though, is instead of just doing that on their own, they now get to share risk with other employers who are also doing the same thing.
Interesting.
And so what
And
that
what's
does
this
is
market
mitigate
like?
the volatility of those large claims.
And Mark, what's this like? Are there, I get, two questions simultaneously thrown at you like a fastball?
Yeah.
Is where are you in this? When was Captivated set up, and where are you in establishing that? And then the second thing is, what's that market like? Are there lots of other people doing something similar?
So we started this in July 1st of 2014. So this is our 11th year of doing
Oh, wow.
this. Captives have been around for a long time, since the 1950s, and primarily used on property and casualty insurance, right? Buildings and equipment and professional
Mhm.
liability and workers' comp. And only in the last 15 years or so have they been used for health insurance.
Okay.
So that's the first answer to your question. Second answer is we started with our existing clients. We do a lot of work with private schools. So we have 100 private schools in our book of business. And we now have 30 of those 100 in a captive program, in a captivated health program. And
Okay.
so instead of these schools going to the market and operating as a 100 person or 200 person, they're now operating as a 10,000 person, right? Because they're all under a group purchasing platform.
Mhm.
So Captivated Health is a platform that we built first for our clients. And now what we're doing, because we have 11 years of success in it, is we're replicating it for other industries. We
Okay.
have one for brokerage agencies that we are partners with. We're getting ready to stand up one for engineering and design firms. We're getting ready to stand up another one for nonprofits. I'm talking to somebody about a manufacturing. It's all the same
And
value. What's
Yeah.
different is the risk is separated by industry. And people always ask, well, why are you separating risk by industry? I'm like, for two reasons. First is the demographics in each industry are very similar, right? The risk profiles, because they hire similar people. So their risk profiles are similar, and the language they use is very different. Like schools call employees faculty and staff, right? Engineers
Mhm.
call them associates. And so there's some unique language with each industry. So we have engineers share risk with engineers, and schools share risk with schools, and insurance agencies share risk with insurance agencies, but they leverage their scale to push down the cost of fixed cost items. And a big example of that would be prescription drugs. So we have secured our own PBM contract, which these schools or these mid-market employers could never do on their own. But
Mhm.
by us collectively going out to market with all that mass, we got a very competitive contract. And we actually have negative pharmacy trend in our Captivated Health platform right now. And in an era
Wow.
where people are 12 to 17% trend in drugs, we're seeing negative 4% in our pharmacy contract. Why? Because it's a transparent PBM. There's no margin in the pricing, so no difference in the cost.
Mhm.
And then the rebates, which in the fully insured model go back to the insurance company, right? Most
Yep.
people have no idea about that. They have
Yep.
no idea if their insurance company is making money off the drugs their people are taking.
Yeah.
And so our contract has those rebates go back to the employer. And so after you're on our plan for 6 months, you start getting quarterly rebate checks. I remember the first check we ever distributed to a school. The CFO called me. He's like, Mark, do you know what I'm holding in my hand? I'm like, yeah, a check for $38,000. This is a 60-person school in the northern part of Maine.
Right.
Amazing.
And he
Amazing.
goes, do you know what that represents? I'm like, $38,000. He's like, no, Mark, seriously. I'm like, no, what does it represent? He goes, that's a job.
Right. Sure.
That's a job for me. He goes, and I'm going to get another check next quarter for the same amount. And then the next quarter, the exact same amount. He goes, I don't like that my people are taking all these medications, but they are. And the reality is this money was going back to the insurance company, but now it's coming to my school.
Yeah.
That's really cool. I'm like, yeah, you're in your balance sheet.
Let me ask you a question. I'll challenging question because we
Sure.
actually had a guest, Amanda, I think, Jim, that mentioned that, and this probably more belongs to like large employers, or kind of higher mid-market, but,
Thousand lives, more than a
yeah, 1,000
thousand
lives,
lives.
but
Sure.
I don't have a number, but generally speaking, larger employers, because on average people stay with a company only for 2 years, they're very short-sighted. The Business Group in Health did just report a 9% increase in health insurance, and companies will say, well, more just goes to the pocket of the employee. Do I really do take care of this, or do I pass the ball down, or
Right.
whatever, roll the rock. I don't know, whatever. You get my point.
Whatever metaphor
Yeah,
works for analogy, it's
whatever the
fine.
metaphor. Yeah.
Yeah.
So how does that work with A, just your observation on that statement, and then B, is that different in that 500 and under market? My assumption is yes, because it's a bit more family-like. You still sort of know everybody. It's very community-oriented, more so than the large organizations. But your
Yeah, no,
thoughts
so
on
I would
this?
say, so larger organizations can self-insure on their own. And they still use stop loss, right, to protect them
Yeah.
from any one person. And then once you get to a certain size of being a self-insured, you don't even need stop loss insurance because from an underwriting perspective, your claims experience is very predictable, right? They're able to weather large claims, they're able to weather bad years because their population is so big,
Yep.
underwriters
Right.
can accurately predict it. So we have a lot of standalone clients that we've replicated the Captivated Health experience for them, but they just don't share risk with anybody. They do it on their own, right?
Hmm.
So, but when the mid-market, it's too volatile for those mid-market companies to do it on their own and succeed over time. And what the captive structure does is it mitigates the volatility. And what I mean by that, I'll give you guys an example. $500,000 claim for a premature delivery of a baby. How's it handled? Well, let's assume it's a 50-person company and they have what's called a $50,000 specific deductible. So for each person they cover, they have a limit of liability up to $50,000. And people do the math. They're like, wait, 50 people, and then I got all the dependents. It's 100 people. You're saying 50,000. That's a $5 million. I can't afford $5 million, Mark. I'm like, that's not
Right.
how it works. It's not linear. You
Yeah.
have $50,000 up to a cap, right, of a certain cap of what your exposure is. Let's go back to my $500,000 claim. The company pays the first 50,000 of that $500,000 claim. And then there's this shared layer, right? We call it a floating layer deductible of $300,000. Of which that employer is a member of that community has contributed to that pot. Let's say each of us are in there, we've contributed to the pot because we don't know
Hmm.
who's going to have a bad year. Okay, so there's money
Yep.
sitting in there. The next 300,000 is paid by all of us, and then the
Yep.
remaining 150,000 is paid by the stop loss carrier.
Okay.
And so that's how you mitigate the impact of a large claim to a small employer. Secondarily, risk transfer mechanism is that, remember, they have a cap on their own experience, right? So there's that second layer of risk transfer. And third is there's a cap for the entire community. Let's say, of our schools, we have 30 of them. Let's say 20 of them had a bad year. Well, there's a cap for everybody in the community as well. So there's 3 risk transfer mechanisms in a captive: individual claimant, the employer's limit of liability, and then the community's limit of liability. That's what a captive does, okay, for mid-market.
Yep.
I don't love captives. I call them actually a stadium. It's kind of a cool stadium. The game of healthcare that's played in the stadium is what I love,
Sure.
which is when I take a 100-person group and I show them that they're being overcharged. Well, Mark, I got a 2% renewal this year. I'm like, right. You know why? The insurance carrier should have given you a -10. Really?
Yep.
How's that? Why? I'm like, because of all this profit that's built into it. The time for you to switch to self-funding is when you get a low renewal. When you get a 30-40% renewal, no one's going to want you to share risk with. I mean, I don't want to pay your claims.
Right. Right.
So,
So Mark, I mean, we can probably talk for hours just on this alone.
yes, we could.
And I'm sure we would lose some people, but would gain others that want to dive in. But there are two, and time is going by so fast that I'm just fascinated with this discussion. But there's 2 key things that we need to still accomplish. One, you were a member of the Delta Task Force of American
Yahoo.
Healthcare Consumer Bill of Rights. And I
Yes.
think I want to touch on ICHRAs somewhere
Okay.
in there. I don't know if
Sure.
they're connected.
And then
And
we
then,
can
of
do that.
course,
So before
yeah,
I move away from Captivated Health, I will
yeah.
share with you guys one thing. I just finished publishing I'm publishing a book on it. It actually
Oh,
just got
amazing.
uploaded to Amazon yesterday.
What's it called?
It's called Can I share on your screen, or is that not
Yeah.
allowed?
Yeah, you can.
Then actually, I'm going to
And
show
and
you
Sp- and Spotify, we're allowed to upload videos now. So anybody who's
So
listening to us on Spotify,
this is the name of the book. It's called Captivated
yeah,
Health.
there we go. Okay.
It's called Captivated Health. Take control, gain transparency, leverage confidence. A
Awesome.
platform to transform your health insurance plan expense into an asset. So there's 100
Um,
pages in here. It's a practical guide. I first demystify healthcare the way I've just done with the 2 of you and tell everybody how the healthcare casino works, because I call it a healthcare casino. And I was sitting in a casino.
yeah.
I started writing this book saying, the friggin' healthcare system's exactly like the casino. The house always wins.
Wins. Yep.
But I don't
Exactly.
want to be on the less bad hamster wheel game anymore. I want to get
Yeah.
off this hamster wheel and I want to take control. So the whole book lays out. So I just want to encourage your listeners. This will be available on Amazon. There are
And
case studies in there. I have 10 clients who actually give actual practical application. Some of the stories I've already shared with you. So
Amazing.
I just want to mention
yeah,
that.
and we'll
So
leave it in the comments when we post as well, the link to it. So happy to share that. And next time I'm in New England, I'll come by for a personal
would love
insight
to.
from you. So
I would love
yeah.
to. And I'll go back to what you asked me about NABIP. So NABIP is the National Association of Benefits and Insurance Professionals. We have roughly, I think, 15,000 members, but if you add up all their staff, it's like 100,000 people.
Wow.
Brokerage agencies, whether they're in the Medicare market, individual market, small group, mid-market, large, mental health, PBMs, all different walks of life inside our healthcare ecosystem. And our whole reason for being is to advocate for public policy. Talk to legislators, talk to regulators is when they get these great ideas they think are great and actually how they land are not so great. We either prevent legislation that's going to be harmful, or if it's passed, we mitigate the damage by focusing on the rules of the legislation, which are regulations, right? So that's our primary job. We go talk once a year to all our politicians on Capitol Hill. We have a fly-in every February called Capitol Conference, and we literally hit the hill for a couple of days and educate our legislators and their staffs about things that we think are important to make private health insurance more viable. So one of the things that I have always been frustrated with, and I talked to you guys about it in the beginning of our conversation, I don't like politics. And so the president at the time, his name's Eric Kohlsdorf. Eric's from Iowa, and he and I have a shared mission about principles and values about how we live our lives and how we think the healthcare system should be constructed. And we both agree that the foundation of healthcare is crumbling, and it needs a new foundation. And the only place you can start, in my view, with a foundation is a set of principles. Right? You can argue strategies and tactics. You can't argue principles. So as an example, we set out to create what is now called the NABIP Healthcare Consumer Bill of Rights. I was a co-creator of that. I told the president when he asked me if I'd head up the task force to focus on creating legislation, I said, I will do it if I can pick my team. And so he allowed me to pick my team, and I picked amazingly bright people from all across our country. And people who focus on every market segment: Medicare, individual, mid-market, large group, pharmacy, mental health. And so together, we created what's now been codified as the 10 articles in the Healthcare Consumer Bill of Rights. And the word consumer was chosen on purpose. It's not patient. Patient implies a one up, one down. And I don't mean that offensively to any clinician. Consumer, I don't always want to be knowledgeable about healthcare when I'm sick. I'd like to actually avoid getting sick. So I need to be a good consumer of how I access healthcare and make better, more informed decisions. So we set out these 10 articles: the right to access affordable healthcare, the right to high quality healthcare, the right to privacy and confidentiality, the right to individual autonomy, the right to health equity, the right to health education, the right to affordable medications, the right to emergency care, the right to healthcare advocacy, and states' rights. And so what we did is we came up with a scorecard, which I'm holding up in my hand. You can't really see it, but
Yeah, hard to see it, but we'll maybe link that as well
I can
if
provide that to you
available.
guys, and
Yeah.
it's on NABIP's website, but it's a scorecard that we use because I wanted to lift the conversation out of politics into policy. So when somebody comes to talk to us and they say, Mark, we really want you guys to support XYZ. I'm like, well, Eugene, I looked at what you put together, and by and large, I think it's a good idea, but you need to do more work on Article 4 and Article 6. Oh, well, what are those? So let's go over those. And then we actually use this scorecard as a scoring mechanism, and if it doesn't score 75% or higher, then we say we can't support what you're asking us to support. But if you go back to the drawing board and you can address those concerns we have, then perhaps we can stand behind it. So it allows us to lift the conversation into principles and policy, as opposed to you're a Republican, you're a Democrat, you're an independent, whatever label you want to place on anybody. So I'm really proud of this, and I'm really excited by it because it was unanimously approved by the Board of Trustees, and now the task force has been created as a permanent committee that reports to the board that's going to focus on how do we make these 10 rights. And when I say right, people automatically think It's a political discussion. Right meaning left often says right means you got to pay for it. Now, I'm not talking about who's paying for it.
Right.
I'm not mentioning anything about payment in here. What I'm talking about is, as a consumer of healthcare, these 10 things are the things that I care about. These are the 10 things my colleagues care about. So let's focus on forgetting about who's paying for it. We can talk about that. But how about we construct a foundation built on these principles, because the old one is not working.
Awesome.
Amazing.
Again, another outward manifestation of my
Yeah,
desire to make
for
healthcare
sure. I
easier and more
mean,
affordable for people.
listen, I'm kind of thinking it's because we've trialed a couple of these like long form podcasts for a couple of hours, right, with a few folks. This probably would have been a good one just to dive deeper in all kinds of corners. But we are, we'll probably have to chat separately on ICHRAs. I think it's a fascinating topic as well. I don't know. Maybe you can give
I
us
can say a
literally two
brief comment about,
sentences.
I
Yeah,
can say a
please.
brief comment about what we call ICRAs, right? Individual
Yeah.
contribution health reimbursement arrangements. I believe they are the end of group insurance, so I don't promote them.
Interesting.
Because I'm in the group insurance market, and I still think insurance will always be the law of large numbers. And when you undermine the law of large numbers, you actually decrease purchasing power for people. That said, we educate our clients about ICRAs, because if you're at the highest deductible possible, if you've increased your out of pocket so much that the plan's not affordable, if you're in an industry that you don't have really good, if you're in some industry that doesn't have really good health population, right, then you're going to have a lot of sick people and a lot of large claims, and you might just get to what I call the end of the runway. There's nowhere for you to go. And so you're like, I throw my hands up, I've got to go to it, because all ICRA is individual insurance offered by the employer. But it undermines the law of large numbers principle of health insurance, and it puts people into the individual market, and the individual market is not very stable. It's not very stable, and it's expensive. So I think ICRAs have a place, but it's at the very
Well, that's
end.
why there's like, I think, less than 1 million people that are using it, right? But
yeah,
anyway.
and there are a lot of people in small group who are really moving in that direction. Why? Because they have no choice. Why? Because they have a system that continues to deliver 10, 20, 30% rate increases, and they can't self-insure like I'm talking to you guys about. Like a 20-person group can't self-insure. I mean, they can, but not like the way I'm talking about.
Yeah, no, agreed.
So
Just too much.
they run out of room. So that's the short answer I have on ICRAs.
Love it. Well, with the time completely running out at this point, I want to pass this back to Jim with his sort of last famous question.
Sure.
Go, Mr. Jim Joyce.
Mark, amazing we to it. So with a lot of self-confidence and self-insured belief system, we project ourselves forward in order to go backwards. So in about, say, 5 years from now, you get an email in, and the address on the email is from the University of Rhode Island, and they're hosting a conference. And the conference that they're hosting is called Wrestling with Big Health Policy, conference. And they've asked you to keynote this conference. And then the talk that you're going to give is how to put your healthcare onto your balance sheet, how to turn it into an asset. So this is the conference there. And the reason they've asked you to speak is because your captivating health book has become a bestseller. You've managed to corner not just a small piece of the market, but inspire all these other organizations to go into it. Your policy statements are being adopted in Washington around the rights of your policy statements. So there's so much to cover in this topic. You're giving a talk, and everyone loves it. Personal stories, talking about what you've done and building the business. But there's this handsome guy that's about 2 rows in as you're giving this talk in the lovely scenic campuses of University of Rhode Island. And you're looking back, and he looks like he's pretty fit. He might have been cutting weight earlier that day, and he's kind of looking at you, and he kind of runs, and he's kind of knocking people over as he's running towards you as you come off the stage after giving the talk to a standing ovation. He says, "Mark, I got to talk to you. You don't understand. I grew up. My parents were clinicians. I moved from DC back to New England." And building all these healthcare practices, I worked my way through accountancy departments. I even joined a rugby club where I drank and knocked people over and had a lot.
Worked out my frustrations. Yeah.
He says, but now I'm about to start my own health care organization where I've been asked to join it, and you look at that younger version of yourself, what's the one simple piece of advice you would give them?
There are a lot of ideas flowing through my brain, as you might imagine. By the way, I like the picture you painted, Jim. So I love that. I
He
love
does
talking
listen.
about
He
things as
does
though they've
listen.
already happened. Yeah. So I definitely want to capture that moment you just shared. But my answer to your question would be pick wisely. And my definition of pick wisely is choose carefully who you spend your time with and who you surround yourself with, because it is the single most important decision you'll ever make in your life. I think
Love
there's
it.
an old adage, you are the sum total of the 5 people you spend the most time with. I used
Yep.
to kind of thumb my nose at that and be like, I like having a ton of friends. As I've gotten older, that list, of I call my relationships like a dartboard, right? In the center is
Hmm.
the red dot. That's family. The green dot is people I love, but they're not blood. And then there's lots of white space. Choose your green.
Yeah,
Choose the green who you
love it.
love, not your family, very, very carefully, because they will be the single biggest determinant of how far you go in your
Amazing.
career. So it's
Pick
who,
wise.
Amazing.
not how. Who, not how.
Pick
Mark, thank
wisely.
you for joining us. It
Thank
was
you.
wonderful to learn about you and the journey. And for all of our listeners, hit subscribe, pass it on, and see you next week.